Thanks, Lawrence. I won't promise to be anywhere near as entertaining as Adam, but I'm loving the fact that he's back in Australia. So yes, I'm going to be talking about consumer participation, and I always feel a bit funny about talking about consumer participation in relation to innovation, because I think at some level we always have had some consumer participation, and I don't know how many clinicians are in the room and how many clinicians would be able to acknowledge that they've actually used drugs and may have actually accessed drug treatment services before, and it's quite often, I think, a bit of an elephant in the room. Having said that, building formal consumer participation within our sector has been something that we have struggled with for quite a while, and when I say we, I mean the sector as a whole. Before I go on, I really need to acknowledge the work of a number of people across the organisation. I won't list them all individually, but I also need to acknowledge the support of the board in supporting our new initiatives around consumer participation. Without the commitment of the board, the stuff that I'm going to talk about today just wouldn't be happening. So ReGen has had a long history of being committed to engagement with all of our stakeholders. That includes the partners that we work with, the service sector, services outside of alcohol and other drugs as well. As a part of that commitment, one of the stakeholders that we have really identified as being really important to be engaged with is obviously the people who access our services. And not just that engagement of clinician to consumer, but also as partners in terms of developing our treatment services. In 2011, ReGen undertook a client participation, diversity and family practice audit, and what that found was that we were actually already doing some good things in terms of consumer participation. In 2012, there was a working group formed that drew people from education and training, from clinical services and from senior management to have a closer look at what we were doing in regards to consumer participation. And the culmination of that is that in this year we are looking at implementing a new model that will enhance our capacity for consumer participation. So why do it? Well, the rationale is pretty simple. Consumer participation is a human right that's well acknowledged both internationally and nationally. We also believe that by involving consumers and putting them in the driver's seat to help us provide services and guide the way that services are run, take part and participate in the planning and the prioritisation of services, that we will see improved treatment outcomes. I have spent 1 day a week of the past year allocated to helping develop consumer participation within the organisation. And while we haven't built a lot of formal relationships, what's happened informally is that clinicians have been coming to me and going, look, I'm seeing this new trend, I'm not quite sure whether it's a trend, would you be able to, you know, talk to some people and find out whether they're seeing it too? And so I'm able to ring organisations like HRV, because in this role I've been able to develop better relationships with consumers and go, what do you reckon? What are you seeing out there? What are the consumers saying to you? And then I'm able to feed that back to clinicians. And that's just one very small example of stuff that's happened that we didn't even plan for. That's just happened as a byproduct of us saying, hey, we want to talk and work more closely with consumers. There was also a number of organisational and strategic drivers, and the reforms have obviously already been mentioned. Consumer participation is mentioned time and time again in the literature around the reforms. We're still not quite sure what that will actually mean in practice. We're right in the middle of a quality assurance audit at the moment, and one of the indicators in terms of quality is about how closely are we working with our consumers, how good are our communications with our consumers, and is it a two-way street? Is it not just us communicating with them, telling them, but also asking consumers what they need and want? And lastly, mental health services have stolen a march in terms of a level of maturity. They've had consumer involvement in their service provision for between 10 and 20 years. With the push to be to work more closely with mental health, if we want some kind of parity, we need some kind of positions that can work with those consumer positions. Now, I'm not saying that we should replicate what's happened in mental health, because AOD is a different sector, it has different needs, but I do think there are some things that we can learn, both some of the positives of mental health's experience of consumer participation, but also some of the things that have worked less well. So what's it all about? Consumer participation is around involving the community in decision-making about their own health, as well as the planning and management of health services. It's integral to effective health promotion and illness prevention. You know, it's not about asking clients how they feel about their treatment plan. That's only one very small component. It's about asking consumers, you know, what do you reckon we should do next in our service planning? What do you reckon's the hot topic issue? What do you reckon's going to be the most important thing for you and your peers, or you and your family? In other words, nothing about us without us. You'd think it would be pretty simple, you know, you'd just ask a few consumers along and ask them what they reckon, and it'd be all good. However, we're not the first people to come as a treatment agency to think that consumer participation is a great idea. There's a number of agencies that have tried in various different ways to implement consumer participation. And invariably, one of the things that in any document that you'll see about consumer participation is this lengthy paragraph called barriers or challenges, or some other nice sounding name that means we haven't been able to make it work, or these things made it far more difficult to work at. One of the issues that we faced is that we wanted to develop a model around consumer participation, and obviously it would be fantastic to involve consumers in developing that model. But that initial planning, one of the obstacles that we faced is things like sustainability. How do you sustain consumers in those kinds of positions? So it was kind of like a chicken and egg thing. Do we start planning this stuff without talking to a whole bunch of consumers first, because we don't have the frameworks and policies in place to adequately support them? Or do we form it on our own and try and get those foundations in place? We took a middle road. We had a look at the literature. You know, and we drew very much from the literature from APSU, straight from the source, but also the treatment service users projects, phases 1 and 2 that were produced by AVIL. Some of the issues that we did identify, obviously sustainability is a large one. The only reason why we're able to advertise a consumer participation position within the organisation is because of the generosity of the board around shaking some money free. This position is not funded external to the agency. Also, issues around tokenism. We wanted to be authentic in this. We wanted to be able to say that we actually have a real consumer participation kind of framework in place, that it's not only the feedback box out the front. So how did we get around that chicken and egg scenario? Basically, we formed a working group. As I said before, that working group drew mainly from senior personnel, but from across both the clinical and education and advocacy directorates. And it was really about nutting out what were going to be some of the barriers and what would be best fit for our culture too. Because remembering that different organisations have different cultures, and introducing consumers into an organisation in a more participatory role can be challenging for organisational culture. I'm happy to say that we had a staff meeting where of all staff at Jessie Street here, where we talked very, very briefly. You know, there was no hard sell to our staff around greater consumer involvement, and the staff at that meeting expressed unanimous support for a greater level of consumer participation, which was fantastic. I've already mentioned those, but they're worth noting down, and for any tweeters out there, I have shortened the links so that you can tweet them very, very quickly. as I said before, the Treatment Service Users Project Phases 1 and 2, a very extensive pairing of research projects undertaken by AVIL, have been really critical in informing where we go from here, as has Straight from the Source, which has been produced by APSU, and we're very lucky to have Heather here today on behalf of Shark, and she'll be talking about something else, but yes, great to have her here. What we found from the work that the working group was doing is that currently the majority of our activities fell somewhere around the information and consultation phases. That is, that we would let consumers know what we were doing, and we would also occasionally ask consumers to let us know what we could do better through the feedback box and things like that, but also through focus groups. So everybody would be aware of the rebranding process. We're no longer called that other name that I'm not going to mention. We're now called ReGen. We have different colours. We have team T-shirts, all of that. All of that was put out not just to staff, not just to external stakeholders that happen to have buckets of cash, but also to our consumers. And very much one of the main things that came back from potential consumers anyway was that the old name and the old kind of vision of Moreland Hall felt a little bit institutional prior to people coming here. Once they got here, they found out we were friendly and we didn't have a set of keys to lock people up. But prior to coming here, there was this real perception about Moreland Hall. That really helped inform our new branding process. It really helped inform how do we make the organisation more welcoming before people even walk through the door. We do some partnership activities, but it tends to be in very small segmented parts of the organisation, and the aim going into the future is that we can increase and enhance the kind of consultative strategies that we implement, but also look at greater partnerships. So that would include having people joining different working groups who have a lived experience, who have been service users, and obviously the first cab off the rank will be the Service User Participation Working Group. We'll need to recruit a consumer to sit with people like myself, with Donna, with James and others to help really inform that process. In terms of focus, we looked at a range of different models, and it was more about being very thorough rather than having a preference over one model, focus to another. There are organisations in Victoria, such as Harm Reduction Victoria, such as APSU, who already do really good work in terms of that advocacy work for service users and consumers. So we didn't want to be another voice there. We didn't want to crowd that space out. So really what we're focusing on is people who may potentially access ReGen services in particular. So the kinds of structures that we're introducing going into the future, the Service User Participation Working Group will actually be reformed as a Consumer Participation Leadership Group, which will provide guidance to the new role that's just been advertised, the Consumer Participation Facilitator. That facilitator will work around training and mentoring and basically supporting a range of consumer representatives. One of the things that we know about consumers is that they're a pretty broad church. Just as drug treatments, different drug treatments offer or meet people where they're at. And so what we wanted to do was be able to draw on the larger population rather than having the focus on just one consumer rep that had to be the be-all and end-all for the organisation. Our approach is all of organisation, which we've had good value out of that in the past in terms of our approaches to dual diagnosis and building our capacity there. The role of Consumer Participation Facilitator is very much about capacity building. It's not just about building the capacity of staff, it's not just about building the capacity of consumers that might be involved in representative positions, but also building a cultural capacity and a policy and procedural capacity within the organisation. And we very much want to be able to evaluate and disseminate this whole process. So what will the Consumer Participation Facilitator be doing? Well, he or she will be getting guidance from consumers. at the same time as providing mentoring and support, and also advocating on the behalf of consumers. The leadership group will be providing guidance to that consumer participation facilitator, but also, I guess, listening to any advocacy messages that need to come through. And the consumer participation facilitator will be providing guidance, mentoring, support to our staff. I'd really recommend, I'm not going to talk about it, but I really do recommend that people check out the consumer participation paper and supporting evidence that we're releasing today. I think if nothing else, it makes tacit our stance on consumer participation and makes tacit about where we want to be going into the future. Thanks.